As we grow older, one of the most fundamental biological transformations occurs not in our bones or muscles, but in the very structure of our sleep. Known as sleep architecture, this internal blueprint dictates how we cycle through the stages of rest, light sleep, deep sleep, and REM or rapid eye movement sleep. In youth, our nights are punctuated with generous periods of slow-wave deep sleep, during which the body repairs tissues, consolidates memories, and balances immune function. But as we age, this proportion of deep sleep begins to shrink, sometimes dramatically. Seniors spend more time in the lighter stages of non-REM sleep, which means that even the slightest noise, movement, or internal discomfort can rouse them from slumber. Studies from the National Sleep Foundation have shown that people over the age of 65 often experience significantly more sleep fragmentation than younger adults, even if the total number of hours they spend in bed remains the same. This leads to a paradox many seniors experience. They feel like they've been in bed all night, yet wake up feeling unrefreshed and tired. The reason lies in the quality, not the quantity, of their sleep. Another key element in this shift is the change in sleep efficiency. Sleep efficiency refers to the percentage of time spent in bed actually sleeping versus tossing and turning or lying awake. With age, this efficiency tends to decline, meaning seniors often lie awake for longer periods during the night. This is not necessarily a sign of something being wrong, but rather a reflection of the aging brain becoming more alert during lighter sleep phases. Research from Harvard Medical School suggests that the brain's arousal threshold, the level of stimulus needed to wake us, becomes lower with age. So what once may have been an ignored creak in the floorboards or a passing car can now trigger full awakenings multiple times a night. Compounding this issue is the reduction in homeostatic sleep pressure, the body's natural drive to sleep that builds the longer we stay awake. In older adults, this pressure accumulates more slowly, meaning that by bedtime, the brain may not be as ready for deep rest as it once was. This often results in taking longer to fall asleep, waking more often, and having shorter overall durations of uninterrupted sleep. And when seniors do wake up, falling back asleep may not be easy. Many older adults report spending long stretches staring at the ceiling in the dark, waiting for sleep to return, a frustrating and emotionally taxing experience. Furthermore, aging alters the circadian rhythms that regulate when we feel sleepy and when we feel alert. The body's internal clock, governed by the suprachiasmatic nucleus in the brain, becomes less responsive to environmental cues like light and darkness. This means older adults tend to feel sleepy earlier in the evening and wake up earlier in the morning, a pattern known as advanced sleep phase syndrome. This mismatch between natural sleepiness and socially accepted bedtimes often contributes to unintentional early morning awakenings. Seniors may fall asleep at 8 p.m. only to find themselves wide awake at 3 a.m., unsure of what disrupted their rest. Even without any underlying health issues, this biological reshaping of sleep makes nighttime awakenings a near-universal experience in older age. It is not a failure of the body, but a recalibration of its priorities. While frustrating, it helps to reframe these awakenings not as anomalies, but as part of a new sleep pattern that may require adaptation rather than correction. In fact, some anthropological research suggests that segmented sleep, a pattern where individuals naturally wake in the middle of the night for an hour or two, was once the norm in pre-industrial societies. In that sense, seniors may be returning to an ancient rhythm, albeit uncomfortably so. Still, frequent awakenings can become problematic when they result in chronic sleep deprivation, which affects not only energy levels but also memory, mood, and immune function. The first step to addressing these concerns is understanding that these changes are not signs of illness in and of themselves, but biological realities of aging. Accepting this can reduce anxiety around night wakings and empower seniors to focus on improving the quality of their lighter sleep through better sleep hygiene and lifestyle strategies, which we'll explore in later sections. Ultimately, understanding the natural evolution of sleep architecture is crucial for older adults who find themselves waking up multiple times each night. These awakenings, while unsettling, are not necessarily cause for alarm. Instead, they reflect a complex interplay of biological adjustments that can be better managed with awareness, patience, and informed intervention. As we dive deeper into the root causes and explore real solutions in the upcoming sections, it's important to begin with compassion for the body's evolving needs and an appreciation for how profoundly sleep changes with time. Beyond the natural changes in sleep that come with aging, a significant number of nighttime awakenings in older adults can be traced back to underlying health conditions, many of which are either undiagnosed or underestimated in their impact on sleep. Perhaps the most prominent of these is sleep apnea, a condition in which the airway becomes partially or completely blocked during sleep, leading to repeated pauses in breathing. These interruptions often result in micro-awakenings, brief arousals that fragment the sleep cycle without the individual always being consciously aware. While sleep apnea is more commonly associated with snoring, in older adults, it may manifest more subtly through daytime fatigue, memory issues, or frequent nighttime bathroom visits. Studies show that nearly 30% of adults over 65 may suffer from some form of sleep apnea, and many remain untreated due to the misconception that poor sleep is just a part of aging. Another major contributor to nocturnal disruptions is nocturia, the need to urinate one or more times during the night. It's so common among older adults that many mistake it for a normal part of aging, yet it can significantly interfere with sleep continuity. Nocturia may be caused by a variety of factors, including reduced bladder capacity, overactive bladder, prostate enlargement in men, or even heart and kidney conditions. Fluid retention during the day can also play a role, especially in those with circulatory issues. When the legs are elevated during sleep, the body reabsorbs fluid, triggering the need to urinate. Even mild cases can be disruptive, particularly if the individual struggles to fall back asleep after getting up. In many cases, treating the root cause, be it cardiovascular health or fluid intake timing, can dramatically reduce nocturia's impact on sleep. Chronic pain is another silent thief of rest, affecting nearly half of older adults. Whether it's from arthritis, back problems, neuropathy, or past injuries, persistent discomfort can make it difficult to fall asleep and even harder to stay asleep. Pain flares often peak during the night due to inflammation and the body's natural temperature drop, which can heighten pain sensitivity. This creates a vicious cycle. Pain disrupts sleep, and poor sleep lowers the body's pain threshold, leading to more intense discomfort the next day. Without proper management, chronic pain can turn the bedroom into a battleground, where even the smallest movement becomes a source of irritation. For this reason, pain management tailored specifically to nighttime symptoms, such as warm baths before bed, topical treatments, and adjustable mattresses, can make a critical difference. Restless leg syndrome, RLS, and periodic limb movement disorder, PLMD, are also significant yet often overlooked conditions that contribute to midnight arousals. RLS causes an irresistible urge to move the legs, usually in the evening or during periods of rest, while PLMD leads to involuntary leg jerks throughout the night. Both conditions can disrupt sleep without the person realizing it. The sudden twitching or tingling sensations prevent deep sleep, causing excessive daytime sleepiness and fragmented rest. These conditions are thought to be linked to dopamine imbalances in the brain and may be exacerbated by deficiencies in iron or magnesium, both of which are common in seniors. A thorough evaluation and targeted treatments, ranging from dietary supplements to prescribed medications, can dramatically improve quality of life and nighttime rest. Gastroesophageal reflux disease, GERD, also plays a quiet but powerful role in nocturnal awakenings. When stomach acid flows back into the esophagus, it can cause heartburn, coughing, or a choking sensation, particularly when lying down. Many seniors experience silent reflux, which presents without classic heartburn symptoms but can still wake them with a sour taste, dry cough, or throat irritation. Because lying flat exacerbates the condition, seniors may wake frequently due to discomfort or anxiety over choking. Elevating the head of the bed, avoiding heavy evening meals, and using appropriate medications can ease these symptoms and promote uninterrupted sleep. Even more insidious are cardiovascular issues like atrial fibrillation or congestive heart failure, which can disrupt sleep through palpitations, shortness of breath, or general restlessness. Though not always directly associated with sleep problems, these conditions can cause the body to become hyperalert during rest, especially if breathing becomes difficult while lying down. Seniors who experience frequent nighttime awakenings should be evaluated for underlying heart conditions, especially if they also report swelling in the legs, fatigue, or irregular heartbeat. Identifying and managing these conditions early can not only improve sleep but also extend life expectancy. Cognitive impairments such as mild cognitive decline or early-stage dementia can also lead to sleep disturbances, particularly in the form of sundowning, a phenomenon where confusion and agitation worsen in the evening. These individuals may wake up disoriented in the middle of the night, wander, or become anxious, which disrupts not only their sleep but also that of caregivers. Establishing structured bedtime routines, reducing evening stimulation, and ensuring a calm sleep environment can help mitigate these effects, though the condition itself requires comprehensive medical attention. Lastly, undiagnosed depression and anxiety often play a hidden role in sleep disturbances. While emotional health will be discussed in more detail in the next section, it's important to note here that both conditions can manifest physically. Tightness in the chest, racing thoughts, or a sense of doom that jolts a person awake in the early hours. What may feel like a physical ailment disrupting sleep is, in many cases, an untreated psychological condition. All of these medical factors underscore a vital truth. Frequent nighttime awakenings in older adults are not just a matter of getting old. They are red flags that may point to treatable, sometimes serious, health issues. Acknowledging these connections is essential not just for restoring sleep but for safeguarding overall wellness. With the right medical guidance and a commitment to uncovering the true cause, seniors can experience nights that are not only longer, but far more restorative. As we dive deeper into the roots of disrupted sleep in older adults, we come to an invisible yet immensely powerful force that governs how we sleep and wake: our internal hormonal balance and circadian rhythm. These two systems are often overlooked when addressing night wakings, yet they sit at the very center of our body's sleep-wake regulation. At the core of the circadian rhythm lies the body's internal clock, orchestrated by a cluster of neurons in the brain's hypothalamus called the suprachiasmatic nucleus. This cluster receives input from light through the eyes and interprets it as the cue to either wake up or prepare for sleep. In younger adults, this system functions like a fine-tuned watch, precisely controlling hormone release, body temperature, and alertness throughout a 24-hour cycle. But as we age, this clock starts to lose its precision. The signaling becomes weaker, more confused, and slower to respond to external cues like sunlight or darkness, making it far more difficult to maintain a stable sleep pattern. Melatonin, often referred to as the sleep hormone, is one of the most important chemical messengers involved in the circadian rhythm. Produced by the pineal gland in response to darkness, it tells the body that it's time to wind down and prepares the brain for sleep. But melatonin production naturally declines with age. Older adults often produce less melatonin and produce it later in the evening than younger people, which can delay the onset of sleep or make it harder to stay asleep. This reduction can also cause sleep to become lighter and more easily interrupted. Research published in journals like Sleep Medicine Reviews and the Journal of Clinical Endocrinology and Metabolism has shown that lower melatonin levels in seniors correlate strongly with more fragmented sleep and earlier wake times. For many, this hormonal drop is subtle but cumulative, contributing to years of worsening sleep that is misattributed to stress, noise, or simple aging. Another hormone that significantly influences nighttime awakenings is cortisol, the body's primary stress hormone. Normally, cortisol levels are low at night and begin to rise just before waking in the morning, helping us feel alert and ready to face the day. However, in many seniors, the regulation of cortisol becomes erratic. Levels may rise too early or stay elevated throughout the night due to chronic stress, inflammation, or underlying health conditions. This leads to restlessness, difficulty falling into deep sleep, or premature waking around 3 o'clock or 4 a.m., a common complaint among older adults. A disrupted cortisol rhythm also interferes with melatonin, further compounding sleep problems and creating a hormonal tug-of-war between wakefulness and rest. In addition to melatonin and cortisol, other hormones play subtle but important roles in sleep continuity. Estrogen, for instance, helps modulate sleep cycles and promotes deep, restorative rest. Its decline during and after menopause is one reason why sleep problems become more common in older women. Low estrogen levels have been linked to night sweats, hot flashes, and increased nighttime arousals. Similarly, testosterone, which also decreases with age in both men and women, has been shown in some studies to influence sleep quality and duration, particularly deep sleep. A deficiency in either of these sex hormones can result in more frequent awakenings and a shallower sleep profile overall. Furthermore, aging brings about changes in the way the body responds to and produces insulin, which in turn affects blood sugar regulation during sleep. If blood sugar drops too low at night, the brain can interpret it as an emergency, releasing adrenaline and cortisol to boost glucose levels, waking the sleeper in the process. This phenomenon is more common in seniors with diabetes or prediabetes, but it can also happen in those without diagnosed metabolic conditions, particularly if meals are poorly timed or overly carbohydrate-heavy late in the day. These blood sugar swings can subtly trigger night wakings and prevent the return to deep, uninterrupted rest. Temperature regulation, another function tightly controlled by hormonal signals, also becomes less efficient with age. The body naturally cools down during sleep as a signal to transition into rest mode. But for many older adults, thermoregulation becomes impaired. They may wake up feeling too cold or too hot, unable to maintain the comfortable temperature needed for deep sleep. This isn't just a matter of comfort. It's a biological signal gone awry. Hormones like vasopressin, which helps regulate hydration and temperature balance, also decline with age, further contributing to these fluctuations. What complicates matters further is the blunting of the body's response to external cues that normally help anchor circadian rhythms. Natural light exposure during the day is a powerful signal that tells the body to stay awake and suppress melatonin. But many seniors, especially those who spend more time indoors, don't receive enough daylight to reinforce this message. Likewise, bright artificial light in the evening, especially from televisions, tablets, and phones, can suppress melatonin production just when the body is trying to initiate sleep. This leads to delayed bedtimes, lighter sleep, and a greater likelihood of waking in the night. It's important to understand that these hormonal and circadian changes don't occur in isolation. They interact constantly, reinforcing or worsening one another. A lack of sunlight leads to lower melatonin production. Elevated cortisol blocks melatonin's effects. Hormonal deficiencies make temperature regulation more difficult, and irregular sleep reinforces hormonal instability, creating a cycle that can feel impossible to break. But awareness of this system offers a significant advantage. When we understand that our body is operating on an aging biological schedule, we can begin to realign with it instead of fighting it. Strategies like increasing natural daylight exposure during the day, using dim, warm lighting in the evening, and establishing consistent wake and sleep times, even on weekends, can support the internal clock and gently correct misalignments. For some, short-term melatonin supplementation under medical supervision may help, especially when timed correctly. But often, lifestyle interventions are just as powerful and longer-lasting. Addressing hormone balance through diet, exercise, and sleep-friendly routines can greatly ease the midnight battles with restlessness and frequent waking. Sleep, after all, is not a passive state but an active hormonal symphony. And in older adults, ensuring the right players are supported and in harmony can transform fragmented, frustrating nights into periods of much-needed restoration. In the pursuit of better health, many older adults find themselves navigating a complex world of medications, each prescribed with the best intentions, but often with unintended consequences. Polypharmacy, the use of 5 or more medications simultaneously, has become increasingly common among seniors, and while these prescriptions are often necessary to manage chronic conditions, they come with a host of side effects that can severely disrupt sleep. When we consider that nearly 40% of adults over 65 take 5 or more medications daily, it becomes clear how significant an impact pharmaceutical routines can have on nighttime awakenings. Many medications, while essential for physical health, interfere with the brain's delicate signaling processes responsible for initiating and maintaining restful sleep. Perhaps the most commonly implicated group of drugs in sleep disruption is diuretics, often prescribed for high blood pressure, heart failure, or edema. These water pills are designed to reduce fluid buildup by encouraging the kidneys to excrete more urine. While effective, they also lead to frequent nighttime urination, or nocturia, which pulls seniors out of sleep and makes returning to rest more difficult. Even if taken earlier in the day, the lingering effects of these medications can persist into the night, creating a cycle of sleep fragmentation that may not be immediately connected to the pill bottle. Adjusting the timing of diuretics, with a doctor's guidance, can sometimes mitigate this effect, but the reality remains. Many seniors are woken not by pain or stress, but by the very medications intended to improve their health. Beta blockers, another common class of medication used to manage hypertension and heart conditions, are also known to interfere with sleep. These drugs can lower melatonin production and blunt the body's ability to enter deep sleep. Many users report vivid dreams, night sweats, or an increased awareness during lighter sleep stages, all of which make sleep feel more like a state of alert rest than true recovery. While not all individuals experience these side effects, the prevalence is significant enough that clinicians now regularly screen for sleep disturbances among patients taking beta blockers, particularly those who report early morning awakenings or frequent nighttime arousals. Antidepressants, widely prescribed not only for mood disorders but also for chronic pain and anxiety, can be a double-edged sword. Some types, especially selective serotonin reuptake inhibitors, SSRIs, may initially improve sleep by calming racing thoughts or reducing depressive symptoms. However, over time, they can also suppress REM sleep and cause restlessness or a sensation of being on edge during the night. Tricyclic antidepressants, on the other hand, may cause sedation but increase the likelihood of dry mouth, constipation, or even urinary retention, factors that can wake an older adult multiple times throughout the night. Balancing mental wellness with sleep quality becomes a tightrope act, requiring continual monitoring and sometimes switching to alternative medications with fewer sleep-disrupting side effects. Painkillers, especially opioids, are another culprit in sleep-related issues among seniors. While they may provide relief from chronic discomfort, they also suppress the brain's ability to enter deep, restorative sleep. Paradoxically, they may worsen the perception of sleep by reducing pain while preventing true rest. Over time, dependence on these medications can also create a rebound effect, where sleep becomes worse when the medication is reduced or missed. Moreover, long-term use of opioids has been linked to an increased risk of sleep-disordered breathing, particularly central sleep apnea, in which the brain fails to send the correct signals to muscles that control breathing. These interruptions can occur dozens of times per hour, leading to fragmented and dangerous sleep patterns. Sedatives and sleep aids, while often turned to as a quick fix, present their own set of complications. Benzodiazepines and newer non-benzodiazepine sleep aids may help induce sleep initially, but they alter sleep architecture, reducing time spent in deep sleep and REM sleep. Over time, users may build a tolerance, requiring higher doses to achieve the same effect. When stopped, rebound insomnia often follows, making the individual feel trapped in a cycle of dependency. In older adults, these medications can also increase the risk of falls, confusion, and daytime grogginess, leading to a decline in both sleep and overall safety. Antihistamines, found in many over-the-counter sleep aids and allergy medications, seem harmless on the surface but can be particularly problematic for seniors. Their sedative properties may help with sleep onset, but they often cause next-day drowsiness and can affect cognition. More importantly, many have anticholinergic effects, meaning they interfere with a key neurotransmitter called acetylcholine, which is critical for memory, attention, and muscle function. Long-term use has been linked to cognitive decline and a higher risk of dementia. Seniors taking these medications may wake feeling confused or unsteady, compounding the sense of sleep being non-restorative or fragmented. Even medications that seem unrelated to sleep can have hidden consequences. Corticosteroids, often used for inflammatory conditions like arthritis or asthma, can elevate cortisol levels, leading to nighttime wakefulness. Thyroid medications, especially if dosed too high, may overstimulate the body and mimic symptoms of anxiety or restlessness. Certain gastrointestinal medications can cause cramping, acid rebound, or bloating during the night, while bladder medications may either overstimulate or understimulate the bladder, leading to nighttime urgency or retention. Each of these medications may appear benign in isolation, but when combined, a common reality in senior care, they form a web of interactions that makes peaceful, uninterrupted sleep a moving target. This is why medication reviews are essential for seniors experiencing poor sleep. Often, it's not one single prescription, but the interaction between many that contributes to night wakings. Doctors and pharmacists can work together to deprescribe unnecessary medications, adjust dosages, or shift administration times to better align with sleep needs. In some cases, alternative therapies such as physical therapy, dietary interventions, or non-pharmacologic pain management may allow for the reduction of sleep-disruptive medications. It's also vital for older adults to understand that medications are not inherently harmful, but they are tools, and like any tool, they must be used wisely. Sleep should be part of every medication conversation, not an afterthought. When it becomes a routine part of healthcare discussions, seniors are more empowered to advocate for themselves and explore safer, more sleep-friendly regimens. In this way, the path to better rest becomes clearer, not just through more prescriptions, but through more awareness, communication, and personalized care. While physical health and biology often take center stage in discussions about sleep disruption in older adults, the role of psychological and emotional well-being is just as critical, yet frequently underestimated. As individuals age, they face a range of life transitions that, while often subtle, have a profound impact on mental health and, by extension, sleep quality. Retirement, bereavement, changes in social roles, reduced daily stimulation, and the creeping onset of isolation can all contribute to stress and anxiety, which are leading causes of sleep fragmentation. Unlike acute insomnia caused by short-term stressors, emotional factors in older adults often produce chronic, low-level tension that simmers beneath the surface, making it difficult to both fall asleep and stay asleep through the night. Depression is a major player in this dynamic and often manifests differently in older populations than in younger individuals. Rather than intense sadness, seniors with depression may experience apathy, irritability, or pervasive fatigue. These emotional states are deeply linked with sleep architecture, especially the regulation of REM cycles and circadian stability. According to data from the National Institutes of Health, up to 20% of adults over 60 experience symptoms of depression, and among them, nearly 90% report poor sleep as a primary complaint. The challenge is that depression in seniors often goes unrecognized, attributed instead to aging itself or physical ailments. Yet its effects on sleep are powerful, including difficulty staying asleep, early morning awakenings, and decreased time spent in restorative deep sleep. It becomes a vicious cycle. Poor sleep worsens mood, and low mood further disrupts sleep. Anxiety, too, plays a pervasive role, particularly in the form of generalized anxiety disorder or health-related worry. Many older adults live with an undercurrent of concern about their bodies, finances, family members, or the unpredictable nature of aging itself. These worries often intensify during the quiet hours of the night, when distractions fade and the mind begins to wander. It's during these moments that seniors may awaken abruptly, heart pounding, with racing thoughts that prevent a return to rest. Even in the absence of a diagnosed anxiety disorder, chronic stress, especially stemming from caregiving duties, financial insecurity, or fear of illness, can elevate nighttime cortisol levels, priming the body for alertness rather than sleep. Sleep becomes lighter, more fragmented, and less restorative, leading to feelings of exhaustion despite spending ample time in bed. One of the most insidious emotional factors affecting senior sleep is loneliness. Social isolation is surprisingly common among older adults, particularly those who live alone, are widowed, or have limited mobility. Research from institutions like the University of California and Harvard Medical School has linked loneliness not only to depression and cognitive decline but directly to disrupted sleep patterns. Seniors who feel socially disconnected often experience more fragmented sleep, more frequent nighttime awakenings, and a harder time entering REM sleep. The emotional toll of not having regular, meaningful interactions takes a physiological toll on the body. The brain interprets isolation as a form of threat, activating stress responses that are incompatible with restful sleep. Even the subtle knowledge of being alone in the house can heighten nocturnal alertness, leading to an overactive startle response at the slightest noise or discomfort. Grief is another potent emotional force that frequently goes unaddressed in discussions about senior sleep. The loss of a spouse, sibling, or lifelong friend can deeply disturb sleep patterns for weeks, months, or even years. The bedroom, once a place of shared rest, may become a space filled with memories, silence, or painful reminders. It is not uncommon for widowed seniors to report waking in the middle of the night expecting their partner to be there, only to be confronted again with absence. Such emotional dissonance often keeps the nervous system in a state of subtle activation, where full relaxation never quite occurs. Grieving seniors may find themselves restless at night, overwhelmed by waves of sadness that peak in the darkness and subside with the light of morning. Without proper support, this cycle can evolve into chronic insomnia that becomes harder to treat as time goes on. Cognitive decline and early-stage dementia also present unique psychological challenges to nighttime rest. Disorientation, sundowning, and confusion can disrupt not only the sufferer's sleep but also that of caregivers. These changes in mental function can create a sense of fear or paranoia during the night, prompting individuals to wake repeatedly, pace, or become agitated. For those in the earlier stages of memory loss, even subtle disorganization in daily routines can lead to irregular sleep patterns, difficulty falling asleep, or a confused sense of time that causes them to wake thinking it is morning when it's still night. The disconnection between internal experience and external reality creates a form of sleep fragmentation that is rooted more in perception than physiology. What makes psychological sleep disruptions especially difficult to manage is their invisibility. There are no blood tests or scans that definitively measure worry, loneliness, or sorrow, and yet, their impact on the nervous system is as real as any chronic disease. The body responds to emotional distress with physiological changes: heightened cortisol, increased heart rate, muscular tension, and disrupted melatonin secretion, all of which make sleep more elusive. Unfortunately, many seniors are reluctant to discuss their mental health, either due to stigma or the belief that it's just part of getting old. This silence allows emotional stressors to grow unchecked, infiltrating sleep night after night. Fortunately, interventions can be both simple and transformative. Cognitive behavioral therapy for insomnia, CBTI, is a highly effective, evidence-based approach that helps reframe negative sleep thoughts, establish calming routines, and reduce anxiety around sleep itself. Programs specifically tailored for older adults are becoming more accessible, with many available through telehealth. Social support, too, is critical. Regular engagement with family, friends, or community groups, even virtually, can reduce feelings of isolation and provide emotional grounding. Practices like mindfulness meditation, guided imagery, and even gratitude journaling before bed have been shown to lower nighttime arousal and promote more peaceful rest. When psychological and emotional health is nurtured, sleep tends to follow. By prioritizing mental well-being just as much as physical health, older adults can begin to reclaim the tranquility of the night and greet each day with more clarity, energy, and resilience. The path to better sleep isn't always found in a pill bottle or a new mattress. It often begins in the heart and mind. After exploring the many biological, psychological, and medical reasons why older adults wake up in the middle of the night, it's time to turn toward hope, concrete, evidence-based strategies that can restore quality sleep and renew a sense of nighttime peace. The good news is that while aging inevitably brings changes to sleep patterns, it does not mean restful, uninterrupted sleep is out of reach. In fact, research shows that with the right habits, environment, and lifestyle choices, seniors can significantly improve both the quality and duration of their sleep. These strategies are not one-size-fits-all, but can be combined and tailored to each individual's needs, resulting in real, lasting improvements that extend far beyond the bedroom. One of the most foundational pillars of healthy sleep is establishing a consistent sleep schedule. Going to bed and waking up at the same time each day, yes, even on weekends, helps regulate the body's circadian rhythm. Seniors often have more flexible daily routines, but this flexibility can lead to erratic sleep patterns if not carefully managed. A predictable schedule trains the brain to associate specific times with sleep and wakefulness, allowing sleep hormones like melatonin to be released in sync with the body's internal clock. When this rhythm is stable, falling asleep becomes easier, staying asleep becomes more likely, and waking up feels more natural and less jarring. Light exposure is another critical tool, especially for seniors who may spend less time outdoors. Natural sunlight is the most powerful regulator of the circadian clock, helping suppress melatonin during the day and reset sleep cycles. Just 30 minutes of morning sunlight, preferably within an hour of waking, can have a profound effect on sleep-wake cycles. Conversely, minimizing exposure to bright screens and overhead lighting in the evening helps the body ease into sleep mode. Blue light from phones, tablets, and TVs can suppress melatonin and delay sleep onset, which is why experts recommend limiting screen time at least an hour before bed or using blue light blocking glasses if screen use is necessary. Even switching to warmer, dim lighting in the evening can signal the brain that rest is near. Physical activity also plays a pivotal role in improving sleep quality. Regular exercise, particularly aerobic activities like walking, swimming, or cycling, has been shown to increase total sleep time and enhance slow-wave sleep, the deepest and most restorative stage. It also reduces symptoms of anxiety and depression, both of which contribute to fragmented sleep. For older adults, exercise doesn't have to be strenuous. Even moderate daily movement, such as stretching or gardening, can yield significant benefits. The key is timing. Exercising earlier in the day is best, as late evening activity can elevate core body temperature and adrenaline levels, which may interfere with sleep onset. Nutrition is often overlooked in sleep discussions, but it has a direct impact on rest. Heavy, fatty meals before bed can lead to indigestion and acid reflux, both of which disturb sleep. Caffeine, found not only in coffee but also in tea, chocolate, and some medications, should be limited after midday. Alcohol, though it may initially make people feel sleepy, disrupts sleep architecture and leads to more awakenings during the night. Instead, a light snack that combines complex carbohydrates and tryptophan-rich foods, like whole grain toast with peanut butter or a small bowl of oatmeal with almonds, can support melatonin production and prevent blood sugar dips that trigger nighttime wakings. Creating a sleep-friendly environment is equally essential. The bedroom should be cool, dark, and quiet, conditions that signal safety and promote deeper sleep. Blackout curtains, eye masks, white noise machines, and cooling mattresses or breathable bedding can help seniors control their sleep setting more effectively. A comfortable mattress and pillow that support the neck and spine are not luxuries but necessities, especially for those managing chronic pain. Additionally, keeping the bedroom reserved for sleep and intimacy, rather than for watching television or scrolling through a phone, helps the brain associate the space with rest. The bedtime routine itself is another opportunity to signal the body that it's time to sleep. A wind-down ritual, practiced consistently each night, can include calming activities like reading, listening to soft music, taking a warm bath, or practicing deep breathing. These habits activate the parasympathetic nervous system, the body's rest and digest mode, which helps counteract the fight-or-flight responses that often keep people up at night. Over time, these rituals become powerful cues, easing the transition from wakefulness to sleep. Mindfulness and relaxation techniques are particularly effective for seniors dealing with emotional or cognitive contributors to poor sleep. Guided meditations, progressive muscle relaxation, and even simple diaphragmatic breathing can reduce nighttime anxiety and calm a racing mind. Cognitive behavioral therapy for insomnia, or CBTI, remains the gold standard in non-pharmacological sleep treatment. This therapy addresses negative thoughts and behaviors around sleep and replaces them with healthier patterns, with research consistently showing long-term benefits even in older populations. CBTI can now be accessed through sleep clinics, therapists trained in geriatric care, and even digital platforms tailored for seniors. For those who experience early morning awakenings or difficulty staying asleep, chronotherapy may be helpful. This technique involves gradually shifting sleep and wake times by 15 to 30 minutes each day to better align with the body's internal rhythm. Used under guidance, chronotherapy can correct advanced sleep phase syndrome, which is common in older adults who get sleepy early in the evening and wake before dawn. In some cases, supplements like melatonin may be recommended, but only under medical supervision. While melatonin can help reset the circadian clock, incorrect timing or dosage can backfire, worsening sleep issues. Magnesium, valerian root, and L-theanine are other supplements sometimes used to promote relaxation, though these should be used cautiously and in consultation with a healthcare provider to avoid interactions with other medications. Finally, regular check-ins with a primary care physician, sleep specialist, or geriatrician are critical. If night wakings are frequent and disruptive, it's important to screen for conditions like sleep apnea, restless leg syndrome, or medication side effects, all of which are treatable. Sleep is not a passive experience but a dynamic process influenced by almost every aspect of health. Treating it as a vital sign, something to measure, understand, and improve, can change the way older adults experience not just the night, but their days as well. Restoring sleep is not about chasing perfection or returning to the sleep of youth. It's about reclaiming control, understanding the body's evolving needs, and creating conditions where rest becomes more likely. With the right strategies, older adults can rediscover the kind of sleep that refreshes the body, sharpens the mind, and nourishes the spirit one night at a time.